Hello everyone, Ramya, Assistant Professor of CSC Department from Rohini College of Engineering and Technology, subject code OEC 754, Unit 3, topic cardiac pacemakers, objective to learn about the various assist devices used in the hospital using pacemakers. Pacemaker. More number of people fall victim to heart attacks and more are critically injured in accidents. Heart block occurs whenever the conduction system fails to transmit the pacing impulse from the artery to the ventricles properly. For example, each pacing impulse is propagated throughout the myocardium, spreading over the surface of the artery. Here, in this, the first degree heart attack, an expressive impulse delay at the AV junction, it causes the P to R interval to exceed 0.2 second for normal adults. Second degree block results in the complete but intermittent inhibition at the AV mode. Third degree block and total continuous impulse blockage. It consists of a pulse generator and the appropriate electrodes. Types of pacemakers. The first one is internal pacemaker. Internal pacemakers may be permanently implanted in patients whose SA nodes have failed to function properly or those who suffer from permanent heart block because of a heart attack. Internal leads connect to electrodes that directly contact the inside and right ventricle. Then next one is here external pacemaker. A external pacemaker usually consists of an externally wound pulse generator connected to electrodes located. External pacemakers are used on patients with temporary heart irregularities including heart block. Here also the pulse generator strapped to the lower arm of patient who is confined to bed. Then next one is types of pacing modes. Several pacing techniques are possible with both internal and external pacemakers. First one is non-competitive. In this method, which uses pulse generators that programmed either ventricular or arterial, that means the pacemakers are designed to operate either in a demand or standby. Here, arterial program pacemakers are always synchronized with P wave of the ECG. Next one is your competitive mode. Asynchronous pacing is called competitive pacing because the fixed rate impulse may occur along with the natural pacing impulse generated by the heart. The next one is fixed rate. Fixed rate paces are used temporarily or determine the amplitude of impulses needed to pace or capture the heartbeat. Here it is sometimes installed in the elder patients whose SA nodes cannot provide proper stimuli. Next one is ventricular program. Both type of ventricular program pulse generator are used when connected to the ventricles through electrodes. It is also able to sense the presence or absence of a naturally occurring R wave. Next one is R wave inhibited or demand. The output of R wave inhibited unit is suppressed as long as natural R waves. Some external demand paces have a sense pace indicator that deflects each detected R wave. R wave triggered. It is a pulse generated is like the R wave inhibited units. It senses each intrinsic R wave. When impulses are transmitted to the cardium during its absolute refractory period, there will be no effect on normal heart activity. Next one is arterial program. In such case of complete heart block ventricles, impulses fails to depolarize, but the artery are able to depolarize the heart block. So arterial synchronous pacings are used. The arterial electrodes are couples arterial impulses to the pulse generator, which then emits impulses to stimulate the ventricles through ventricular electrode. Here the pulses applied directly to the heart rate, usually rectangular in shape with a duration of 0.15 to 3 second. Depending on the type of pulse generator and the needs of patient is used. Here, therefore, the fixed rate pacemaker on and the output is given to the output amplifier. Then the signal is given to ventricle through electrodes. Block diagram of component circuitry. It consists of RC network, reference voltage source and comparator in the timing circuit. It determines the basic spacing rate of the pulse generator. Then the output is given to the second stage RC network, that is pulse with generator. Here in this block diagram we have pulse with circuit. It determines the stimulating pulse duration. The next one is rate limit circuit. It is used to disable the comparator for a preset interval and also limit the pacing rates to maximum 120 pulse per minute. The output circuit, it is used to provide a voltage pulse to stimulate the heart rate slow down circuit. Here we have refractory circuit. It is provides a period of time following an output pulse. And then the sensing circuit, it is used to detect a spontaneous R wave and reset the oscillator timing capacitor. The next one is methods of stimulating of pacemaker. Two methods we have. First one is external stimulation. It is used to restart the normal rhythm of the heart in case of cardiac standstill. The next one is internal stimulation. It is used to employed as long-term pacing because of parameter damage that prevents normal self-triggering of the heart. In both methods of stimulation, bipolar electrodes and unipolar electrodes are employed. Here we have some differences between internal and external pacemaker. For the pacemaker is placed outside the body, it may be in the form of wrist, watch or in the pocket. But in the implanted, another one name for internal is implanted. The pacemaker is surgically implanted when if the skin near the chest or abdomen with its output leads are connected directly to the heart muscle. Next one, endocardiac electrodes are applied to the heart. They are in contact with the inner surface of the heart chamber. Myocardiac electrodes are in contact with the outer wall of the myocardium, that means heart muscle. It does not require open chest surgery, but in the implanted it requires open chest minor surgery to place the pacemaker. Battery can be easily replaced and any defect can be easily attended without the help from doctor. Here battery can be replaced only by minor surgery and doctor's help is needed to rectify the defects. During the placement of pacemaker, swelling and pain do not arise due to minimum foreign body reactions. During placement, swelling and pain due to maximum foreign body reaction. There is no safety for the pacemaker, particularly in case of child carrying the pacemaker. There is 100% safety for circuit from the external disturbances. The external pacemakers are used for temporary heart regularity. Implanted pacemakers are used for permanent heart regularity. Here we have some specification of pacemaker. Weight 33 to 98 grams, reliability 3.5 to 18 years, end of life indicator 2 to 10% drop in pulse rate 25 to 155 pulses per minute, pulse width 0.1 to 2.3 milliseconds, pulse amplitude 2.5 to 10 volts, battery capacity 0.4 to 44 to 3.2 amps hours. And the components of pacemaker, it consists of pulse generator, electrode and battery. Here the pulse generator is used to generate the pulses for heartbeat. And the electrodes are used to connect the pacemaker and the heart. The battery is used to work up the pacemaker. Thank you.